Hi, I'm Dr. Gerald Molloy here at Total Spine and Wellness, Total Spine and Orthopedics with one of our patients. How are you feeling?
I am feeling great.
Terrific. Tell me a little bit about what was happening before your surgery.
Well, I've been in pain for a little over 20 years from a car accident, and then I had another car accident, and that compounded, and basically I couldn't move my head left, right, up or down without excruciating pain.
Did you plan that surgery was going to be the answer for you?
I did not plan that surgery was going to be the answer for me. I did a lot of research. I had other surgeons that wanted to go in and do a fusion, and that's when I found you guys.
But we didn't do a fusion for you.
No, you did not.
What did we do for you?
You did the disc replacement.
Right, so we did a 2-level total disc replacement, which is an artificial disc. It's well tested. It was originally designed around 15 years ago in Europe and brought to the United States. Is now a US product, and it is a great alternative for the right patient for the kind of surgery that you needed, which was to decompress your spinal cord. What were the symptoms you were having before surgery?
Numbness down my left arm. Also a lot of shoulder, all the way back in here, and even some mid-back pain. Some of the cervicals can affect all the way down the back as well.
And how far out are you from surgery?
I think it's been 3 months now.
3 months. And over the last 3 months, you've continued to feel like you were getting better and better. And now, what's your pain level on a scale of 1 to 10?
I would say my pain level is absolutely 0.
Terrific. That's it. That's what we plan for everybody. And what are you planning to do now? What you asked me if you could go do?
I have a cruise booked, and we're going to Panama and Costa Rica, and I wanted to be able to go ziplining, so I didn't know if that jerking motion of the stopping, because I've done it before, would affect it.
I said it shouldn't affect things as long as you don't fall, in which case everything is going to be at risk, not the area of artificial disc. But we said, okay, if you want to do that, that sounds like a great activity.
I'll come back and let you know how it goes.
Terrific. Maybe some video.
All right.
Great.
Thank you.